Welcome to Talk to Me, a podcast to provide a safe and brave space to have courageous conversations about the changes we want to see for system-involved young people. The aim of this podcast is to support young people with issues that are commonly encountered in the foster care and juvenile justice systems, and offer resources to navigate and overcome these issues. We really have exciting guests, subject matter experts, and young people with lived experience on today's episode. Before we get started, I'd like to offer a land acknowledgement. The creators of this podcast recognize that we occupy land originally and still inhabited and cared for by the Tongva, Tatatvion, Sereno, Quiche, and Chumash people. We honor and pay respect to their elders and descendants, past and present and emerging, as they continue their stewardship of these lands and waters. We acknowledge that settler colonization resulted in land seizure, disease, subjugation, slavery, relocation, broken promises, genocide, and multi-generational trauma. This acknowledgement demonstrates our responsibility and commitment to truth, healing, and reconciliation, and to elevate the stories, culture, and community of the original inhabitants of Los Angeles County. We are grateful to have the opportunity to live and work on these ancestral lands. We are dedicated to growing and sustaining relationships with Native peoples and local tribal governments. To learn more about the first people of Los Angeles County, please visit the Los Angeles City/County Native American Indian Commission website at lanaic.lacounty.gov. Now on to the episode.
Hi everyone, my name is Sherrie Bradford and I'm the host of this podcast, Talk to Me podcast, Take to Me podcast. And today we're going to be talking about substance abuse and psychotropic medications. And we have these lovely guests here with us that are going to introduce themselves. So let's start off with.
Hi, my name is Angelique Russell. I am a producer, writer, songwriter, and I was one of the producers on the Elevate Youth California documentary Recovering Innocence.
I'm Dr. Scott Hunter. I'm a child and adolescent and addiction psychiatrist. I run a co-occurring disorders clinic, which treats young people with substance use disorders and other co-occurring mental health conditions in the youth carceral settings in Los Angeles County.
And my name is Michael Nash, and I am the executive director of the Los Angeles County Office of Child Protection for the last 9 years. Prior to that, I was a judge here in Los Angeles County for 30 years. The last 25 years, I was a juvenile court judge, including 17 years as presiding judge of the juvenile courts here in Los Angeles County. And I think I bring to the broadcast here a unique perspective on the use of psychotropic medications for young people in our child welfare and our juvenile justice systems, because by a quirk of law, judges here in California have the obligation to approve or disapprove the use of psychotropic medications for system-involved children.
So we're going to get into our first question. So what are some challenges that you see around substance abuse or psychotropic medication with youth in care and then the youth that are exiting care?
I can start, certainly. When it comes to, let's talk about substance abuse, which, I'm not by any means an expert on that, but certainly within the framework of our child welfare and juvenile justice systems, one of the things that we need to do is do a better job of identifying those young people who have an issue, with the use of various substances. And the bigger issue is, how do we engage those youth so that we can successfully provide them the treatment that they may need for any issues they have with substance abuse? When it comes to psychotropic medication, that's a different issue. Because there are a number of challenges with respect to that. First, we need to ensure that psychotropic medications are being utilized for treatment purposes rather than controlling the purposes of controlling the behavior of youth. And secondly, when I think about the use of psychotropic medications on children, there are two things that come to mind. Number one, last resort. The psychotropic medication should be used as a last resort when other treatment modalities don't work. And secondly, and certainly I think much more importantly, the key word is vigilance. When a child is being administered psychotropic medications, we need to watch them like a hawk, because the use of psychotropic medications, while it can be very helpful, it's not a precise science, and therefore, we need to be very careful with how we use them, and we need to be very vigilant in the use to make sure that the medication is having the desired impact on the child.
It's great to have the opportunity to be here, because I'm often in the situation where I'm prescribing the same medications that then advisors like yourself is reviewing, and it's rare that we actually get the chance to sit side by side or face to face. But it's, I think so many things you said, and substance use and other psychotropic medications, they're one of the things that I'll see, a young person could be struggling with certain behavioral issues that actually may be related to substance use, and then they're being pushed into treatment, and recommended potentially a medication, where you're actually seeing some symptoms of a substance use disorder or problems related to substance use. You emphasized the importance of identifying substance use when it's there, and I think that's often so difficult, because I don't think we do a great job sort of in the various systems where we have the potential to offer help of creating a welcoming environment for accurate reporting around substance use. That I think that a lot of the time there's fear for, the young people I see, they're fearful of giving me accurate information around what substances that they're using. I work in the juvenile justice setting, work with incarcerated youth specifically, and it takes a while to gain the trust, and also let them know that this is a non-judgmental environment where they can tell me what's going on, what they're using, so we can have a conversation about what's ultimately going to be the best for their health. And the other thing that makes me think of when we're talking about these two different yet interrelated subjects of psychotropic medications and also substance use is that, I think about medications that can be helpful when there is a true addiction, when there's a substance use disorder. And unlike perhaps other mental health conditions where you might think about medications as being of a last resort, we want to be thinking about medications for substance use disorders, honestly, as a first resort, or earlier on, maybe a 1.5 resort, immediately after, and having the being able to offer medications that have the potential to be life-saving when there's a serious substance use disorder present. And unfortunately, I think it's still difficult to access those medications in many settings. I think we're trying to improve it, and I think that it's safe to administer those medications even in primary care doctors' offices, from psychiatrists' offices. But a lot of psychiatrists and primary care doctors don't yet feel comfortable doing so.
So can you reiterate, because I wanted to understand, so you're saying, let's say someone has a substance abuse issue, that it's okay to use the medication as to help with the substance abuse issue?
Yeah, great question. There are certain medications and then certain substance use disorders, right? So if we get specific, specifically opioids, right? And opioids are far more present now than they were certainly 20 years ago. But, we're now in the third wave of the opioid epidemic with the advent of fentanyl and other synthetic opioids that are kind of really now dominating the supply of the drugs that are on the street. And whether they're advertised as Percocets, they rarely are, right? Or oxycodone, that's not what it is. It's actually fentanyl pressed to look like a Percocet. And so with those being more widely available, I'm seeing more and more young people, we are in the juvenile justice setting and in the community as well, who have developed severe substance use disorders or even moderate substance use disorders to opioids. And that particular medication, the real risk is overdose, right? And it's not simply the development of a lifelong addiction that will cause problems in the long run, but it's really a short-term serious problem, right? Where there's a real risk of overdose and death in the near term. And in those situations, there are medications that are safe in adolescents and young adults that can prevent that overdose. And so what I'll do if I'm interacting with a young person who is telling me that they're regularly using opioids and they've had the experience of going through withdrawal because they've become dependent on them, I'll let them know that there are options, that there are choices, there are medications that they could use, that I could prescribe them, today that will prevent the risk of overdose. And then if they're not ready, or perhaps they don't have a severe enough substance use disorder where and what we might say for that, or to understand it, is that, they're experimenting with substance use, they're using here and there, it's not really a true like opioid use disorder yet at that time, then you might offer another medication, which is important for everyone to know about, which is Narcan, right? And sort of Narcan is the overdose prevention or overdose reversal drug, right? So if someone overdoses on opioids, you can administer a Narcan nasal spray. It's almost like the sort of thing that everyone should have in their glove box or on hand, right, nearby, like the same way we have defibrillators on the walls in airports and that sort of thing in public buildings. Have access to Narcan, because if you find someone who's not responsive and you don't know why, it very likely could be an accidental overdose. You can administer the medication and it'll save their life, right, while you wait for an ambulance to come.
Specifically for youth that are in the child welfare system that maybe had, and I know you could speak on this next too, that may have a background in like over medication and things of that nature, would you suggest kind of using medication to supplement the over medication, or is there other ways, like alternative ways where they can wean off? Like how, like I wanted to know, like how can you have those conversations, and then what would that look like?
It's a great question. I think, even thinking of some of the cases I'll work with where that's exactly what I see. I have a patient coming to me who's on 4 medications, and I'm now diagnosing an opioid use disorder, right? So I'm in a position where I want to recommend this life-saving medication, like I said, because it's kind of a medication first type situation, which otherwise should be rare. And yet I feel badly putting them on 5 medicines, right? So that's generally the process we talk about right away, which is like, I think this is the most important medicine for you. And if I can either understand from them, right, especially if it's an older teen, but when I say older, I really mean like 14, 15. I mean, there's well-formulated, strong and knowledgeable opinions about medication, even at that age. And so trying to understand how can we be more purposeful with medication so you don't have to take 4, but we're rather thinking about what is the indication of each of these medicines. I mean, as you said, are these medicines used to treat a behavior, or is it treating an underlying mental health condition? So being sure about the diagnosis before saying, oh yeah, I think you need to be on 5 medications, right? And I have been in situations where it's like, look, that there's, I'm not sure what you're really dealing with, because you're dealing with a severe addiction. You're dealing with severe substance use disorder, and that might actually be why you're feeling depressed, why you're feeling anxious. It might have a big part of why you're having trouble paying attention. What if we just step away from all the medicines together and try treating your substance use disorder? And then we'll see. And then we can see. And if you're still feeling depressed, we can talk about what the options might be in that situation. But I think that I think I have an advantage in this setting, and it is difficult working with youth in the juvenile justice setting, because I wish many of them weren't there when they have to be. It does sometimes afford me the opportunity to work with them over the long term, which I think youth in care are unfortunately often sort of seeing one doctor and then another doctor and then another doctor, and never having that experience of continuity where you can actually begin that process of narrowing the medications down and trying to be more purposeful.
Yeah, I think that's a very interesting point to bring up about like how we need to be sure of the diagnosis and just making sure that we're not just spraying over like a blanket over what could be a very like pointed issue. Because for me personally, at the age of, I started taking medication at the age of 7 years old. And I was on several different medications, because all I told my social worker at the time was like, hey, I talk to myself sometimes, and they were just like, oh, you have schizophrenia, so we need to put you on medication. And I think for me, just growing up with that experience of like not having that pointed diagnosis, because I was also diagnosed with just autism. in general. So I think that was something that they had either missed or something that they had not really been focused on. Was that part of like what was going on with me developmentally at that age? Because like even little kids talk to themselves all the time. They have like imaginary friends. That's how they cope. That's how they deal with hardship, especially being in the foster care system, with the abuse that I went through with my mom and things like that. So I just think for me, like being put on Geodon, being put on Abilify, being put on Trazodone, being put on all these different types of medications, sleeping, slobbering all over myself in class, like just having that experience because it just wasn't like a focused enough thing of like, hey, let's just figure out what's really going on here. Is it just, is it trauma induced or is this an actual chemical imbalance? So I think that's something that I can speak to that I wish would have happened personally for me, just having that point of diagnosis at such a young age.
I wanted to add on to her because I'm a part of the documentary that she was a part of producing. And I started at 5 and I was on a bunch of different medications and I didn't get off of medication till 21. But I had, as you said, like I had so many different psychiatrists, right? And based on the developmental of where I was at. So like when I was like 15, 16, they're like, oh, you have bipolar disorder. So we're going to put you on Latuda. And then there was like one point where it was like, I literally was like doped up on so many different medications. They were like, we don't know what's wrong with you. So I was on like Abilify, Latuda, Lexapro, Buspron. I was in and out of the hospital trying to figure out. I was like, I don't understand what's going on. But I had been on so many different type of medications all the way from 5 all the way till 21. And one of the biggest things was I was like, I don't want to have to take medications. I don't. And for me, it was like just socially, like when I would go to summer camps, they would come to me with the little blue pill Adderall and they'd be like, here's your med. And I would be like, I'm not trying to be looking crazy in front of these, you know? And now as an adult, when I have anxiety or stuff like that, I now know and I'm mindful, okay, if I do this, I'm in charge of this. But I think when I was very younger, I don't think I necessarily was in charge of anything. And then also to talk about the child welfare system, I know that my foster parents got paid twice as much for all me and my brothers being on medications because we were considered quote unquote D-rate. So I also thought like, as I started getting older and seeing how much money was coming in, how much resources they were coming in, I also was like, oh, am I just somebody who's gonna pop pills for you guys for like a paycheck? So I think too, like for me, I wish I would have had that situations where I could sit down with a psychiatrist and be like, okay, so this is what's going on and this is the type of medications I'm interested in. Can you also tell me about the side effects of these medications? But I didn't really have that. I really had meetings. My foster mom was right there. She's crazy. She's doing this. She's being defiant. She's being aggressive. So in those meetings where I'm actually supposed to be talking about stuff that I'm going to be taking and also going to the foster youth bill of rights, I didn't know that at 12 that I was able to like be in charge of that. But I think what, as you were saying, is like, now I'm listening and I'm like, I didn't even know that. Like, I didn't even know, like my brother, unfortunately, when he got out of care, he was so doped on medications, he started getting crystal meth. There's been ample amount of times where like his mentors found him and he's like not breathing and they're breaking windows to get him in. So I think too, just seeing how drugs have affected, but also medications have affected my family. It's really hard as like a youth with lived experience to not look at it and question like, is this the most susceptible type of treatment for our young people?
I just think for me, it's like one of the reasons, the main reason why I actually started being over medicated was because I had an incident at one of my elementary schools where I had gone through so much trauma. My mom was schizophrenic. I just got removed from her. The cops lady just came and took me away. And I was going through so much. I didn't know how to like really like express myself or how to channel what I was going through. And I ended up just having a fight at my school. And they were like, either you get her help or she's kicked out of the district. And that meant getting kicked out of the district means getting kicked out of my home. And at that age, I could either go to another foster home or I could go to another group home because I already had bounced around quite a bit at that age. for me, it was like, okay, like what kind of help was that supposed to be for me? Putting me directly just on medication, like letting that be like the first resort rather than being willing to sit down and talk to me. And because I mean, I think at that age, I wasn't like someone that was like crazy violent without like going through like, some sort of trauma. So I felt like there could have been another alternative way of getting you the help rather than just automatically like put her on medication. We need to keep her docile. We need to keep her relaxed. We don't want to deal with her. So I think that's just something that
And you felt like it was more for control thing rather than to help you.
I think it's more for control. Yeah.
And what I wanted to ask both of you, because you guys are a part of the process of you're working with these youth, you're talking with these youth, you're engaging with these youth. How would you, quote unquote, you listen to both our lived experience. How would you, quote unquote, have those conversations as far as like, because it's gaps, right? How would you have that conversation as far as, hey, there's this youth, they're over medicated, they don't have, it's like healthcare. When you have Black and brown people who kind of don't trust a system, right? It's a lot harder to have those conversations. So how do you have that conversation, especially about what you said? Hey, you're on 4 different medications, but we could probably put you on this one that might subset all those other ones. How do you also, in your line of work, have conversations about building more safety around medications and substance abuse for the young people and educating them on those things?
I'm getting PTSD listening to you because I had been on a mission for over 30 years to improve how we use or don't use psychotropic medications on youth within our system. So, the first thing it is to make sure, that number one, when a child is brought to a physician, that physician is competent, to make an accurate diagnosis and prescribe the appropriate medication. Now, as a judge, as I said at the outset, judges in California have the duty to approve or disapprove the use of medications. So we are the line of last defense. Okay. So number one, the first mission was to ensure that when I need to make a decision to approve or disapprove, that I'm getting, sufficient and significant information from, once again, a competent physician, who has the expertise, to make this recommendation. So we have a form, with all this information on it. And so first thing I need to do is make sure that the form is completely filled out and that the information is accurate. Okay. Now, if I don't pretend, and the last time I looked, there are no judges on the bench in California who are licensed psychologists or psychiatrists. Right. So we defend on people like Dr. Hunter.
Yeah.
Okay. And so if I disapprove of a medication, it's not because I disagree with his diagnosis necessarily. It means that, number one, the information was not complete, or number two, by questioning that I ask and so forth, I find out that the information is accurate. So let me give you an example. Years ago, I remember specifically I had a case where I got the request for medication. Diagnosis was ADHD, and it was one of the, medications used for ADHD. And I'm reading the report about the child. The form said, well, the child had these different behaviors, blah, 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 which of course, came from the caregiver. Okay. And then I'm reading the report, from the social worker, says kid's doing great in school, no issues, this, that, and the other. I said, hey, there's a disconnect here. Okay. So I'm not going to approve that medication until that disconnect is cleared up. So that's one of the roles of the judge. Okay. To make sure, that there is a diagnosis from a competent physician, that the information is accurate, and also that they have addressed the question of whether or not are there alternatives to the use of medication. If I don't have all that information, then I can't make the decision. Now, and so here, I would say here in Los Angeles County, we have been a nationwide leader in our protocols. In number one, the forms that are used. Number two, we were maybe the first or one of the first jurisdictions to also create protocols for the monitoring of the use of medication. So, when I first started, you'd sign off on the medication, and 6 months later they'd come back, with a new form because it's only good for 6 months. And they said, well, that doesn't tell me, whether the medication is good or not. So, but if I, mandate that I get a report or, after the medication is being used on what impact it's having, then, once again, we can begin to monitor the use of the medication. Also, one of the things that we implemented here in Los Angeles County was what we call a youth engagement worksheet. We want youth to be engaged in the process. I think we want we want youth to know what they're taking, why they're taking it, how they feel about it. Okay, and I don't think anybody in the country has implemented a process like that. And of course, one of the reasons that we implemented a process like that was so that when a youth turns 18 and they have to make the decision for themselves whether they're going to continue the use of the medication, are they capable of making a rational decision on whether or not to utilize the medication? Now, all that being said, I think we have the best protocols in the country. But once again, it's a case-by-case, determination. Okay, is the judge paying attention? Is the social worker paying attention? Is the caregiver paying attention? Is the child's attorney paying attention? And that is the ultimate challenge, to make sure that everybody takes this issue seriously, because I think it's one of the most important things and significant things that we do within the framework of our child welfare system and our juvenile justice system.
And we are going to be wrapping up this segment in a minute, but I wanted you to speak and maybe put it a part of your call to action. Like, what is something, because I know you work and you distribute these medications and stuff like that. What can you tell other system leaders, other people that are working one-on-one with these youth, but also maybe other people who are also a part of the process of distributing medications, on what is the best way to support a youth in a way where when they are being prescribed medications, if this is the method they want to go, that they feel safe, they feel seen, and they feel heard. And then I also wanted you to have a call to action for any of the young people, as far as like who may be going through this process. Like, what kind of advice would you give them? And then we can wrap it up with you, Judge, at the end.
I think, I'm reluctant to say it even, but the first thing is to doctors, talk to your patients, right? And when you gave the example of sitting in a room with your foster mother, having to give a history, or just sit there and be quiet while your foster mother gives the history, and that's not appropriate, right? And so to talk to really a child, really of any age, you need the opportunity to have them in a confidential environment. And sometimes you may not get the information you need from them because they don't trust you yet. Then that's your objective, is to build that trust so that you can actually communicate with them. That can be a slow process, but it's worth taking the time. There's a lot of pressures in the system that you've described. The school is saying you can't come back unless you start medication. The foster parents saying they're out of control. They can't stay with me anymore unless they take medication. And the foster mother couldn't find the clinic, and so they're 30 minutes late. Now you only have 20 minutes left to finish the appointment, right? And so it's easy to reach for that prescription pad, but that's not good medicine, right? That's not what we were trained to do as doctors. And if you have to slow down the process and say, no, I need more information, I'm not ready to make this decision. It's not in the best interest of this child to make this decision at this time, and maybe everyone's frustrated that we can't make this decision yet. But that's how it has to go. And the process you've described, it's there for that reason. It's there to essentially back doctors up and do what they're supposed to do. And so it's useful in that way. And yet still we have it's not perfect, right? As we've heard. And I hope it's improving. And then I think the other call to action is for young people, advocates, to ask the questions themselves. To recognize that the doctor wants to hear from you, and that you're having side effects. Give an example of how it's impacting your life. And if you are an advocate for a young person, help train that young person on what they're going to say to the doctor. Oh, when you go tell the doctor, so go see the doctor, you told me this about how you're feeling about your medicine. Tell the doctor the same thing. Like, let's practice how you're going to tell the doctor. You want me there with you to tell the doctor? I can be there with you to tell the doctor, right? So helping young people communicate with doctors in a way that they can hear what they need to hear. It's the other thing.
Yeah, I love that too. That was really good. You actually took some of what I was going to say. But it's all good. That means we're all on the same page. I think my call to action I would give would be for the youth to be their own advocate. I think that's so important in a society where you feel like they don't have a voice, or they feel like they can't share certain things, or especially if you've been hurt for so long, there's very sacred parts of yourself you just are scared to share. And I think in order for you to be able to get the help that they need to be able to push past that and really advocate for themselves, and also do the research. There's so many resources out there to be able to know what your rights are as a foster youth, as a former foster youth, as a current foster youth, as a TAY youth, just really going after just doing what it takes to make sure that you know what you have a right to, and also knowing and understanding that you know yourself better than anyone. I think that's something that's definitely helped me in my journey with medication, is that I know myself better than maybe my doctor knows me. And if I can help my doctor get to know me, then my doctor is able to actually help me. So I think that's the advice that I would give.
I guess my last point is, once again, doesn't really matter what the issue is. We need to recognize that every child in the system today, all 20,000 of them, is a crusade and a mission unto themselves. Every one of those children is the most important person on earth as far as we're concerned. And on really every issue, but particularly on this issue of the use of psychotropic medications, because we're talking about something that can be as harmful as it is helpful. And so I go back to where I started. Vigilance is one of the key words for everybody. Everybody who works and has anything to do with these children has to be vigilant on this particular issue.
Thank you guys so much. And I just want to leave some lasting remarks. I never in a million years would think that I would be, as a youth myself with lived experience, seeing my peers is awesome all the time. But I think actually getting to meet people that are actually doing the work, it's just like a full circle moment. And I wish you were my judge back in the day. And I also wish you were my psychiatrist. And it actually makes me tear up because I really didn't feel like I had a voice back when I was in the system. But I'm so glad that the youth before me, the youth after me, and even me are advocating for these changes, because it's apparent right now, just in front of our faces, that we have people fighting for us and that are on our side. So thank you so much for the work you're doing. Thank you so much for contributing to this podcast. I want to thank you, Angelique, for opening up, for sharing your story. And yeah, we're going to wrap this up now. All the resources that were shared here today is going to be in the credits, and stay tuned.